In genitourinary pathology, we look mostly at prostate, bladder, and kidney tumors, and a small sampling of testis tumors also. To me, one of the largest issue that we're dealing with right now, because prostate cancer is the #2 cancer in Swedish hospital in our system in general, is trying to define which prostate cancers are significant. So grading the prostate cancer, coming up with new biological markers to say which prostate cancer will be more aggressive or needs to have surgery, which prostate cancers surgery may not be appropriate due to the stage or grade of the tumor, trying to help stratify those patients into the best treatment group for that patient is really important. And I think there's a lot on the horizon as far as looking at molecular markers in prostate cancer that may help us make those decisions for patients. Because we see so much cancer here, well over 1,000 prostate cancers a year, we have the breadth of experience, all of us, to really pick up on subtleties, rare variants. It's frequently that you have to do some special tests on a prostate biopsy. And one of the beauties of what we have here is that we're able to get that special test the same day that we see the first slide of the case. So it's the same day that we see the H&E sections, that's the first section that you look at, we can order that special test if needed and have that back the same day and able to turn that report out in 24 hours, where in many other places that would take 2 or 3 days to get that result back. That type of thinking is the general mission statement of CellNetix, is to treat each patient, each client as an individual. And I think that's part of the culture in general, to really do everything we can with each specimen, each patient, to give the best diagnosis. And I think that culture of the consultation between the specialists here is very good. And I think that's something that's just kind of grown over the last 30 years with some leaders of this group that started the group. We all have our phone numbers on the reports, so if you sign out a cancer or any specimen on a patient, your phone number goes with that report. But I think that's probably one of the great things about working in a place like this, is we have a very strong clinician colleagues that if there's some question about a case, they have no problem or don't any qualms about calling us immediately and to discuss the case. And I think that makes for a very strong pathology group.